Well, good afternoon, everyone, and thank you all for joining us today as we take another step to fight against the substance abuse epidemic in West Virginia. Before we get started this afternoon, I'd like to take a moment to recognize our Secretary, Joe Thornton, of the Department of Military Affairs and Public Safety. Joe, I want to thank the work that you and your team are doing to support justice reinvestment and to find ways to combat substance abuse in our communities all across the state. Substance abuse has become one of the greatest struggles our state has ever faced. Since 2011, my administration has made the fight against substance abuse a top priority, and we're committed to making sure that those who are struggling can find help and hope here in West Virginia. Over the past several years, we've worked hard to increase community-based substance abuse treatment and recovery options across the state. In 2011, I formed the Governor's Advisory Council on Substance Abuse to find more localized ways to combat substance abuse in regions around our state. We've updated our prescription drug monitoring program, cracked down on the sale of drugs used to make meth, and cracked down on doctor shopping. We've invested more than $39 million in state funding to expand local community-based treatment and recovery services. And since 2013, we've nearly doubled existing treatment facility options to better meet the needs of those struggling with substance abuse. Last year, I introduced the Opioid Antagonist Act of 2015 to provide families and first responders with access to life-saving drugs to help reduce the number of overdose deaths in West Virginia. And with the help of the legislature, I signed this bill into law. In 2015, first responders administered more than 3,000 doses of Narcan, giving those struggling with an opioid addiction the opportunity to get help. But while we've made significant progress tackling this epidemic, there's still a lot more work to be done. And that's why my 2016 legislative agenda includes 2 new pieces of legislation to build on the progress that we have made and strengthen resources across our state. The first bill is to establish licensing requirements for medication-assisted treatment facilities that prescribe Suboxone and Methadone. This legislation promotes a comprehensive approach to treatment that requires counseling and behavioral therapies to be used in addition to these medications, to give those seeking help the holistic support they need to begin the recovery process. My second proposal expands the Opioid Antagonist Act of 2015 by making Narcan available to any West Virginian without a prescription. This bill aims to decrease overdose deaths in West Virginia and helps us keep track of who is receiving Narcan to better focus state resources in areas hardest hit by opioid overdoses, to be sure it isn't being used as a crutch to enable a heroin addiction. Together, these proposals will give us another way to make a difference in the lives struggling with abuse. This September, we launched the state's first ever substance abuse call line, 844-HELP-4WV. This 24-hour helpline provides referral support for those seeking treatment and recovery services in their local communities. As many of us know, those struggling with an addiction are often reluctant to take that first step. Now, West Virginians have the opportunity to just talk with the professionally certified call line specialist and discuss available treatment options, choose a path, and begin the road to recovery. Today, the helpline has been in place for nearly 6 months, and 844-HELP-4WV has connected nearly 1,000 West Virginians with the resources and treatment they need to find help and return to their families, their workplaces, and communities. As part of our helpline launch, we've also created a brochure that I'm sure that many of you have seen. Got her right here. We've also created this brochure. It details the 150 treatment options across the state of West Virginia, where people can get help close to their home with the support of their family and friends. And this brochure is available online and at schools, hospitals, churches, DHHR offices, libraries, and courthouses in all 55 counties. Scott Jarrett, the Vice President of First Choice Health Systems, is with us today to share more about the Helpline's success and what it means to the people in West Virginia who are struggling with substance abuse. Scott?
Well, I just want to say thank Governor Tomblin for having us here and speaking very highly of our organization. We're real excited about the program. And I want to start by saying I was born and raised in West Virginia, like a lot of you folks were, and had the opportunity through my career travels to work in different states. And one of the states, I worked in New Jersey and New York area. And one of the opportunities there, I was working with youth in that area. And when I would come back to West Virginia, folks always asked me what it was like to live in New York in that area. And I kind of thought for a little bit, and I thought, well, you meet nice people everywhere you go. There's just not as many in that area. Now, I say that because West Virginia is local. You know, what the solution to this problem that we have in this state is good West Virginia folks helping other good West Virginia folks. And I'm proud of this program for what we've done. We launched this program in September, as Governor Tomblin said. The program is a 24/7 helpline, and you're going to get a person on that line, and that person's going to assist you and help you. We do a warm referral, which means our call agents stay on the line until we make that appointment. We also have peer support specialists. Those are folks that are in recovery that can help through that situation. And it's really vital that those folks can talk to people and they can share their experiences, because there's a lot of folks that don't know that experience. But it's definitely an integrated effort, and we want to make sure folks get that treatment. When people are ready to finally seek treatment with their family members, we want that first call to be us. We definitely want folks to call that because it's important. For folks that are in this system, we can find it difficult to navigate that system, even though we're in the system. And for folks outside of that system, it can be extremely cumbersome. And we want to give folks hope that there is treatment. And there are lots of facilities, there are lots of treatment providers around the state. But I definitely am very appreciative of the leadership of Governor Tomblin and the state and DHHR for putting this proposal out here, and for First Choice being able to get this and run this helpline. But again, it is about local folks helping local folks. We're all touched either by our family or friends with folks that struggle with substance abuse and addiction. Last week I had a friend of mine, her ex-husband passed away at 35 from an overdose. Again, that's too often a story, but we want to tie that into there is help, that it's not hopeless. And if I could say anything to echo what Governor Tomblin said, this is about hope. It doesn't have to be a dead end. This can be about treatment and recovery, and we've got folks working in our call center that are all about that. When you see our folks in recovery, they understand that journey that they've taken, and they understand there is light at the end of the tunnel. So again, I want to thank so much Governor Tomblin's leadership on this problem, the state of West Virginia and DHHR. We're very proud of this initiative, and we continue to evolve it and make it and tweak it, and with your guys' feedback, we can make it much more impactful, and very much so something that we can model in other states, as opposed to us import. We can export this opportunity and tell folks what a great job we're doing in the States. So again, thank you for this opportunity. I really appreciate the opportunity to speak, and thank Governor Tomblin for his leadership. Thank you so much.
Thank you very much, Scott. You guys are doing a great job down there. So, man, your entire team, I think it just, it really shows the need when you got 1,000 people who've taken it upon themselves to pick up that phone and get up the nerve to call and ask for help. So we appreciate it. Today, we're expanding these services that I've talked about here today by establishing new critical substance abuse treatment services in 8 counties where services were once limited or non-existent. Through my Justice Reinvestment Initiative, West Virginia is on track to invest a total of $9 million to support substance abuse treatment services by helping those who have served time for drug-related crimes transition back into their communities. And this afternoon, we're awarding more than $1.5 million to 9 different substance abuse treatment service projects across the state. This funding will be used to support nearly 150 new inpatient treatment beds, a women's recovery residence, outpatient and intensive outpatient services, and will place community engagement specialists and recovery coaches in every county. It is my hope that today's announcement will help those who need it most. We're spreading the message. If you or a loved one is struggling with substance abuse, there is help and hope for you in West Virginia. Treatment and recovery services are available, and they have helped West Virginians like Jermaine Sanders. Jermaine is with us today to share how treatment and recovery services are helping those who need it. Jermaine?
The fact that I'm able to stand here before you today is nothing less than a gift. Being asked to share a few words on a program that saved my life is an honor. My name is Jermaine Saunders. I'm 25 years old, and I'm from Beckley, West Virginia. For the most part, I had a really good life. I had mostly everything that I needed and everything that I really wanted. I was raised by my father and my 2 grandmothers. I had 6 siblings, 2 sisters and 3 brothers. In 2013, I lost my brother due to drugs. That was something really hard that I had to deal with, and there was a lot of feelings and emotions that I had to deal with, and I really didn't know how to deal with it. And someone came up to me and offered me something that was supposed to help me. And I took it, and it made me feel a little bit better at the time. So I continued to use, and it was suppressing the feelings. It made me feel normal at the time. I found myself using opiates. At this point, I really couldn't find a way out because it was an everyday thing. It was the only thing that I knew what to do to try to make it through the day. After I didn't seek for help, and I really didn't want to tell anybody because I was embarrassed, I had burnt all of my bridges. My family was distant, and so were my friends. Little did I know that I was suffering from a disease called addiction. I had a friend that worked as a drug counselor, someone that I could confide in and ask for help. And she says, you know, I know of a number. I really don't know how it works, but you should give it a try. Let me know how the results are, you know, after you call. And that number was 1-844-HELP for West Virginia. And I called, and there was a young lady named Jamie who answered the phone. And the first thing she said to me was, how are you doing, and what can I do to help? I had been waiting to hear those words for the last 3 years of my life because I did not think there was a way out. I did not know where to begin to start looking for help, and that's what really helped me the most. Jamie called me every day when she was looking for a program for me to go through, and that was really important to me. You know, there was never any judgment. She always had that encouraging word to help me through the day. In just a short period of time, Jamie called me back, and she had a bed for me at Huntington, West Virginia Recovery Point. That is now where I reside. They are giving me the tools to learn how to deal with a life on life's terms, how to build a new life. And everything that happened, I'm trying to find the good in it so I can use it to help someone else that is going through the same thing in their life. I'm very blessed to be there in this facility and see people come in and see, I was able to see a young man and his parents come into a meeting one evening, and you could see in the remorse and the sadness and the hurt in these parents' heart. And she asked me, she says, you know, how did you get in here? And I said, you know, I really don't know how to help you, but I can give you a number that helped me out tremendously. And I was able to give her one of these cards. And the look in her face to know that there was something out there that could help her, you could see the peace, you know? So I have a very special thanks for the West Virginia Helpline and to Recovery Point. I have a very special thanks to Jamie for helping me along the way. I still have a long road in recovery, but my future is a lot brighter. God bless you all. Thank you for the opportunity to stand before you and share my story.
Thank you very much for that personal story, Jermaine, and thank you for sharing it with us. And we're so proud of you and the steps you're taking toward recovery, so keep up the good work. At this time, I'd like to welcome and introduce David Stevens from Open Minds Recovery Services. Open Minds is one of the 9 projects that will be receiving more than $500,000 to develop a Level 3, 100-bed recovery residence. And I'm confident this project will help fill an immediate need and serve the people of Fayette, Raleigh, Summers, and Wyoming County well. So, David, there you are. Welcome, sir.
On behalf of Open Minds Recovery Services, I would like to thank Governor Tomblin, the Division of Justice and Community Services, the Day Report Centers, Mayor Kissinger of the City of Mount Hope, Global Contact Services for providing us a building, and countless others for making the years plus work come to fruition today. The drug death rate has increased 47% in the last 2 years. The West Virginia leads the nation in drug deaths, nearly 3 times the national average. Drug overdose deaths are the leading cause of injury death. Marijuana is followed by prescription drugs and the most abused substances. The number of painkillers prescribed from 1999 to 2013 quadrupled, as did the death rate. The percentage of children living in poverty in West Virginia has increased 43% during those 10 years. Most people die from drug overdoses. More people died from drug overdoses in 2014 in the United States than ever before, roughly 50,000. Deaths in 2014 from drug overdoses exceeded car accidents by 1.5 times. The death rate following drug overdoses has increased 137% since 2000. For opioids, the rate has increased 200%. Opioids, primary prescription pain relievers, and heroin were the leading drug related to overdose deaths. Opioids were involved in 61% of all overdose deaths. This is 3 times the rate from 2000. Heroin overdose deaths have tripled in 4 years. Just a little bit about us. Services is a new kid on the block. It was founded after almost a year of research for the best way to address this concern. The organization developed from a community outcry to a solicitation to a solution to the substance abuse and criminal justice system problem. The rate of recidivism and financial and emotional costs is far too high. Families and communities are torn apart and are being raised by grandparents. Much of this is due to the ever-growing drug problem in southern West Virginia. Open Minds Recovery Services is a new organization incorporated in West Virginia to address this great need. The board of directors consists of members with the desire to make a difference. These include a local minister, a former substance abuse user, a pharmacist, information technology specialist, a licensed social worker, and a drug task force leader. Open Minds Recovery Services exists to eliminate barriers, provide services, improve skills, and strengthen individuals, families, and communities. Open Minds will offer direct services, support, and training to strengthen individuals to address the challenges of life without resorting to substance abuse or criminal behavior. Clients will receive life skills training, word skills, access to basic adult education, peer recovery coaching, disease management services. The outcome will be a reduction in recidivism, lowering the justice system costs, and improving client outcome. Clients will receive referrals to necessary care and treatment during their residential stay. This will help stabilize behavioral health concerns and learn coping methods to address life issues that are productive. A safe return to the community is the ultimate client goal. Community engagement specialists will seek community partners to provide housing and employment options. These services will be offered to remove barriers to obtaining resources needed to be self-sufficient. As a new facility, Open Minds Recovery Services will educate the public regarding services provided and the population we target. Most people have felt the impact of addiction among their family and close friends. Community engagement specialists will provide opportunities for others to understand our mission. We are excited to move forward. We're excited to move forward with this project and look forward to a future of service in southern West Virginia. Thank you.
Thank you very much, David. I know these services will make a difference in the lives of so many people who need it. I just happen to notice, looks like the Senate has recessed or adjourned for today. President Bill Cole and Senator Williams and Senator Sipole, that's all I see back there. But you know, the money we've been able to put in to be able to create the services in our communities, it comes with the approval and support of the legislature. And I want to say thanks to the members of the legislature, Mr. President, and members of the Senate for all your help, not only 1 year, but for the last 5 years, because I think together we are really making a difference in people's lives in West Virginia. Now to Now, to all of our funding recipients today, I want to say congratulations to you, and I look forward to hearing about your future progress. So we'll begin today's grant presentation. Secretary Thornton, do you want to call the recipients out, please?
Thank you, Governor. Before I get started, I just want to briefly mention a component division of the Department of Military Affairs and Public Safety is the Division of Justice and Community Services, who's really spearheaded this effort to establish the substance abuse treatment services around the state. So I just want to acknowledge Rick and Jason Metzger in the back of the room for their hard work on this. Great job. So I have the privilege of reading off the entities and the award amounts, and I will briefly mention what the award amount is intended to serve, and then as I call out those entities, if you would please come forward and have an opportunity to take a picture with the governor and receive the award letter. Thank you. First, for Fayette, Raleigh, Summers, and Wyoming counties, Open Mine Recovery Services in the amount of $501,100. These funds are utilized to develop a new Level 3 100-bed recovery residence and support the positions of community engagement specialists and recovery coaches. I'll try to step out so I don't photobomb your photo opportunity there. For Berkeley, Jefferson, and Morgan counties, Jefferson County Day Report Center in the amount of $102,579. These funds are utilized to support additional support positions of a community engagement specialist and recovery coaches. Next, my home county of Mercer, the Community Action Southeastern West Virginia, or CASE West Virginia, in the amount of $217,366 to develop a new Level 2 women's recovery residence and support the positions of community engagement specialists and recovery coaches. Next, serving Greenbrier County, the Greenbrier County Commission, in the amount of $80,000. These funds are utilized to support the positions of community engagement specialist and recovery coach. Serving Logan and Mingo counties, the Logan-Mingo Area Mental Health in the amount of $160,231, utilized to establish an 18-bed Level 2 recovery residence and the positions of a community engagement specialist and recovery coach. Next, serving the counties of Grant, Hardy, Hampshire, Pendleton, and Mineral, Burlington United Methodist Family Services in the amount of $161,627 to establish a 15-bed Level 2 recovery residence and a position of community engagement specialist and recovery coach. Next, serving Mason County, the Mason County Commission, in the amount of $68,825 to support outpatient and intensive outpatient services, as well as community engagement specialist and recovery coach. In Putnam County, Prestera Center in the amount of $106,022 for supporting outpatient and intensive outpatient services, as well as community engagement specialist and recovery coach. And finally, serving Kanawha and Cabell County, Recovery Point of West Virginia, in the amount of $149,000 for the continued operation and expansion of support services of a recovery coach and community engagement specialist.
Okay, don't take long to blow $1.5 million. But once again, that concludes our grant presentation today. And once again, I just want to say thank you for all of you that is involved with this this dilemma that we have in our state and in our. We appreciate all the hard work that you do, and Jermaine, hang in there, buddy. You're gonna make it back. Thank you all for coming today.